will tell us about the situation in the hospital authority. Dr. Chang.
就我簡單介
Good afternoon, everyone. So I'll briefly talk about the latest situation in Hong Kong. For the past week, the number of confirmed cases from the previous 7 days from 6,300 cases to 7,900 cases, which is an increase of 24.4%. For locally acquired cases, there is an increase of 25.6%. The number of cases was about 7,300, and for today, the number was 8,500. For the previous week, the number was 5,800. For imported cases, there is also an increasing trend of 21.5%. Imported cases constituted about 7.4% of all positive cases because there are more inbound travelers. So the percentage of inbound travelers tested positive was below 4%. For death cases, because there were more positive cases, so the number of deaths increased as well. For the past 7 days, the figure was at 14.7%. For the past week, the fatal number of cases was 78. For the previous 7 days, the number was 68. For Omicron subvariants, a few strains that are more popular overseas are of our concern, such as BQ.1.1 and XBB, with a relatively large number of cases, as we can see, especially in imported cases. For locally acquired cases, for BQ.1.1, they account for about 1.007%, for XBB 2.06%. For BA.4 or 5, they account for about 75%, and for other BA.2 descendant lineages, they account for 20.86%. This is the latest situation in Hong Kong. As for residential care homes for the elderly, this is something that we are very much concerned about because they are of relatively poor health, and the number of death cases may be serious. In the past week, 79 institutions reported cases with 117 residents, and for RCHD, the numbers remain stable. 31 institutions reported new cases. With 43 resident cases, there is a slight increase. There were also 2 staff cases. As we can see in this graph, the number of residential care homes with cases has increased. Be it RCHD or RCHE, there were increasing trends. For schools, we also see an increasing trend. There were more number of schools requiring class suspension because they have to conduct RAT every day. This prevented large-scale outbreak in schools. So when students are tested positive, they won't be attending school. So for the most part, schools are operating as normal. For sewage surveillance, on the left, number of confirmed cases, and on the right, the overall situation of sewage surveillance. They are quite similar. So the figures on the right were collected a bit earlier than the ones on the left, but they are at somewhat a peak level. Globally, from 14th to the 20th of November, the overall number of cases has a slight decrease of 5%. The number of deaths also decreased by 13%. But the WHO remarked that because of the decline in tests administered, the number does not necessarily reflect the real situation. Globally, BA.5 remained predominant, 72.1%. For BQ.1, there are relatively more cases appearing, 23.1%. For XBB, 3.3%. In summary, for locally acquired cases, there was a sharp increase of 25.6%, that is a quarter. We are mainly concerned about the situation for RCHE. For imported cases, the number continues to increase as well, but the proportion remains stable below 4%. We are keeping a close eye on the COVID subvariants overseas and locally. We have detected some subvariants locally as well, and we will keep a close on that. Thank you, Dr. Chuang. Dr. Lau, please. Good afternoon. Let's look at this graph. In the past week, for hospitalized patients, the number remained on the rise. For the past few days, there were more than 2,500 patients hospitalized in HA facilities. Compared with the beginning of October, there was an increase of about 40%, from about 1,600 to 2,500 in the recent few days. The increase is about 40%. For newly admitted cases, the number is also rising. From a few days ago, the number was at 300 to 350 patients currently requiring treatment in hospitals. Just then, Dr. Chuang has mentioned that in this wave, RCHE has relatively large number of confirmed cases, and the proportion of them being hospitalized has also increased. What does this graph show? Among the admitted patients, how many of them are from RCHE? You can see that the number is on the rise. In the previous week, the figure was at 16%, and for the past week, the figure was at 18%. The lowest point was about 11 or 12%, and now the figure is at 16%. So there are more number of positive cases from RCHE, so more of them were admitted to the hospital, which accounted for the increased proportion. I think we all know that elderly who live in RCHE may have underlying illnesses and who are immunocompromised. So if they are infected with COVID, so the proportion of them needing to be admitted to the hospital is much larger than the elderly in the community. So we have to handle them with care. Among the hospitalized patients, there are more than 100 critical or serious cases. This is understandable because the number of patients hospitalized has increased, and more of them come from RCHE. So there are more critical or serious cases. But fortunately, the proportion of the patients requiring ventilator support is less than 1%. And those requiring oxygen therapy is around 10%. The proportion is about the same, but as you can see, the number of cases has increased. The actual number of cases has increased, but fortunately, it is still within a controllable range. This is mainly because of the increased proportion of vaccination and the early administration of oral medication. This prevented worsening of conditions of these patients. They provide better protection for these patients. From data submitted by A&E doctors for the past week, patients hospitalized through the A&E department, for 60% of them, they were admitted because of reasons related to COVID. For 35% of these patients admitted to the hospital, they were admitted due to other medical needs, such as previously mentioned, their underlying conditions like heart disease, bone fractures, or other medical reasons. For the past week, 70% of patients who died in public hospitals died of reasons related to COVID. For the remaining 30%, for now, we believe that they die due to other medical reasons. I think we all know that the weather is turning cooler now. So we are concerned that the number of cases hospitalized will continue to increase. This will, of course, pose pressure on public hospitals. We will keep a close eye on the latest development, adding new bed and manpower as necessary. We need to strike a balance between taking care of COVID patients and providing other services. We have other patients admitted to the hospital requiring other medical treatments, for example, heart disease or stroke, etc. They need to receive treatment in public hospitals as well. Recently, we have increased the number of designated clinics and teleconsultation services so that patients under isolation can be provided with proper treatment. We also enhance medicine delivery services so that patients at home can start their medication as soon as possible. Here, I appeal to patients who have obtained positive results to seek medical attention and medication as soon as possible. The early administration of oral COVID medicines can reduce the chance of serious conditions by 80%. So for elderly age 60 or above, people with chronic illnesses or immunocompromised persons, seek medical attention as soon as possible. When you show symptoms, you can utilize online appointment systems and teleconsultation services so that we can deliver the medication to you as soon as possible for you to start your course of treatment.
Apart from COVID cases, we see that as the weather is turning colder, we see more cases that are related to COVID-19. And on top of that, we have the threat of the winter influenza. So I appeal to you all that if you are not vaccinated, please do so as soon as possible. At the same time, get vaccinated for influenza as well. These are two different types of vaccines, but they both protect you from serious cases or fatality should you get infected, because it takes time for the vaccines to work. That's all for my report for today. Thank you. I believe that after hearing from Dr. Zhang and Dr. Lau, you get the idea that all the cases are on the rise, including number of deaths, number of confirmed cases, number of cases in residential care homes for the elderly, among schools, sewage surveillance, as well as number of admissions. It's not the case that the epidemic is on the decrease. Usually it changes. When the epidemic situation stabilizes, we have to stay vigilant and continue with all the preventive measures to guard against a rebound. But now, when we see a rising trend, we do not have to feel panic. We don't have to panic, and we don't have to feel that we're losing hope, because there are still a lot of work that we can do. The work we can do at the moment is, of course, get mentally prepared, don't panic, but at the same time, don't feel that is nothing to do with you. You have to remain vigilant. Secondly, in face of rising number of cases, we need to protect ourselves. Wash your hands regularly, wear your mask properly. That means don't pull your mask down to below your nose and don't rub your eyes after you've touched your mask. And if you've been exposed to high-risk situations, please do RATs or PCRs. And I also ask members of the public to monitor your health. If you feel any ailment, no one knows your body better than yourself. So if you feel unwell, please do an RAT. On top of that, take good care of your family members, the young and the old. As you all know, that the vaccination rate amongst the young and the old are not satisfactory. So if you know anyone who hasn't been vaccinated, please ask them to get vaccinated as soon as possible. For people who have been confirmed with COVID, but they are unvaccinated, I ask you to tell them to get medical consultation as soon as possible. Go to a designated clinic or use the teleconsultation service. The case is different for everyone. Some will have mild symptoms. For others, they may have high fever, bone ache. You can use the service of the HA. You can also use our teleconsultation service. Please don't rush to the A&E department. As you have heard, that the temperature will drop next week when the weather is getting colder. I'm sure that the young can very well take care of yourself. But for the young and the old, or if you have old people or young children at home, they may not be able to take care of themselves as well, and they are not as strong in constitution as yours. So please ask them to take care of themselves and help them if necessary. In our fight against the epidemic, there are three elements. First of all, that's to do with the nature and characteristics of the virus. That is that it mutates very easily, as you have heard from Dr. Zhang, that we have an increasing number of sublineal or subvariant. However, the prevalent strain is still BA4 or BA5. The second element is the development of the epidemic is something that is beyond our control. The third element is the protection on different levels. I talked about regular tests, observing good personal hygiene, wearing masks. These, however, are within our control. So if you want to create conditions for our activities to resume normal, or if you want to protect yourself against this slight rise in cases, then listen to what Professor Yun said. Regular tests, wear your mask, and get vaccinated. On the 30th, starting from the 30th of November, those between 5 and 11 are required to get 2 jabs. And above, if you're above the age of 11, you have to have 3 jabs before meeting the requirements of vaccine passes. In relation to bivalent vaccine, it will arrive in Hong Kong in a few days. We hope that at the beginning of December, we will make available bivalent vaccine for members of the public. As experts said, for bivalent vaccines, it can be used as a booster for those above the age of 12. In Hong Kong, we use it as the 4th jab. In general, if you're between 15 and 18, you can get the 4th jab. If you're above the age of 50, we would advise that you do so. Those between 18 and 49, if you go to high-risk places, then I advise you to do so. And those between the age of 12 and 17, if you have a strong immune system, you can still get the 4th jab as a booster. So you don't have to, it's not the case that you have to be immunocompromised to get a booster. If you have at one point been infected, it's treated as one vaccine. So if you are above the age of 18, if you have received 2 jabs, and if you've been infected once, then it's the case that you have 3 jabs. And if you have If you have 3 jabs and you've been infected, then you don't have to get the 4th jab or use the bivalent vaccine. If you're unclear, I'll elaborate later. And I would like to cite Dr. Anthony Fauci. Uh, he is the chief medical officer of the White House. He said in his last press conference before he retired that wearing masks, vaccine, boosters, and tests are very effective measures to protect yourself and your family. Authorities or authoritative figures in the world all say the same thing, that is, tests, vaccination, and wearing of masks. Then we all need to think, what is the most effective way for yourself and for people around you? If you haven't received any vaccination, please do so as soon as possible to protect yourself and the people around you. And I'd also like to take the opportunity to thank healthcare workers in the public sector as well as those working in homes. We've gone through 3 years of fight against the epidemic. It is not a short time and is way beyond our expectation. They have worked relentlessly to serve the public and to care for our patients. Well, that's all I'd like to say for today. Now the floor is open for questions. Identify yourself before you ask questions. The person at the back. I'm from cable TV. For bivalent vaccine, when it arrives, they're only available for those having the 4th jab. Would it completely replace existing vaccine? If I wait to get the 4th jab, can I get the original vaccine or can I get the bivalent? What about those who have not completed their course? Can they choose a bivalent vaccine? What about at the Amber Code? You said that the number of imported cases has increased, but the proportion amongst the total number of cases is the same. So is it still necessary to restrict those with Amber Code to enter certain places? First, I'd like to talk about bivalent vaccine. According to experts, and as recommended by the pharmaceutical company, it is only suitable for use as a booster. So for bivalent vaccine, it is only for the 4th jab. We introduced the bivalent vaccine as an additional choice. If you want to use the original vaccine as your 4th jab, that is fine. Bivalent vaccine will not replace that. It's only that you have 2 choices. About the Amber Code, the proportion has not increased. I'm talking about number of imported cases, but the actual number of cases has increased from 200 to 300, 400 to 700 today. So it's a marked increase. And at the same time, the number of local cases is on the rise as well. If we relax any of our restrictions, it is not ideal and it is not safe for the general community. So at this moment, we will not cancel the Amber Code. The gentleman in a dark top. I'm from AM 730. I'd like to first ask about the epidemic. There is a rebound. Have you assessed the situation to find out the cause? Is it because of relaxation of restriction measures? Which age group has seen the highest number of cases? And you talked about a rise in number of cases. Does it mean that in the next round of social distancing measures, there will not be any relaxation? And in relation to vaccine passes, what is your assessment about the number of people who are valid or not? And can you give me more information about other aspects as well? We have, for number of confirmed cases, is the age group in the middle, that is between those in their 20s and their 40s. But the number of cases is on the rise for elderly people as well. So as Dr. Chuang reported, number of cases among the elderly is increasing. Dr. Chuang, it's very difficult to say in general what caused the rebound. There may be many different factors. People are more relaxed, people engage in more activities, number of imported cases increases. We have actually analyzed the number of cases amongst elderly home. For second infection is about 3%. However, in elderly homes, the number of confirmed cases account for only a small percentage in overall number of cases. However, the number of reinfection has risen from a single digit to about 20 to 30%. It shows that about in February and March, about 70% of the residents have been infected, and it's over 6 months, so their antibody level has dropped. There is a chance for them to get reinfected, and sometimes they are not as the antibody level is not as resistant against variants. However, the fatality is not as high as that in the fifth wave, that is back in February or March. So they have immunity either from infection or from vaccination. Regarding adjustments of social distancing measures next week, we're closely monitoring the overall situation and the development of the epidemic. We heard that we're only taking baby steps in relaxation. Sometimes it is necessary because the epidemic situation changes all the time. We have to be cautious when it comes to adjustments of our social distancing measures and anti-epidemic measures, and we need to do it right as well. So it depends. For vaccine passes, we have about 200 applications. Next question.
The gentleman in the last row. I'm from Singtao Daily. There are about 9,000 newly confirmed cases today. So does that mean the number will go to 10,000 soon? So will the peak number from the last wave was about 11,000. So that will we go past the peak? Is it because of the increased social activities of the members of the public? The government has emphasized that they would not backtrack on anti-epidemic measures. Do you still stick to that goal? Will there be hidden worry and that we may tighten those measures again? For residential care homes, there are a few temporary holding centers, and visitation arrangements have been relaxed by the SWD. Will the arrangements be adjusted? Will you further discuss this with residential care homes regarding visitation arrangements, perhaps allowing more family members to visit? Last time, Dr. Lau said that if the number reach 2,000 cases, there will be new beds allocated. Well, now we have surpassed 2,000. So will there be new plans for bed mobilization? For visitation arrangements of the residential care homes, I'll hand it over to Dr. Chong. Well, I know that LWB has had a meeting regarding visitation arrangements for residential care homes. I think these measures will be looked into to see if there is any room for improvement. I'm sure that they will be announced in due course. Well, perhaps I'll respond to the other questions. So now the number is at 9,000. What will the peak be like? Actually, for now, we can't say for sure. So in today's briefing, All the anti-epidemic measures have remained unchanged. We will keep an eye on the latest development. Of course, it is possible that the number will continue to go up, but we can't say for certain. And secondly, there are many locally acquired cases. Well, the characteristic of COVID is that its power to change. It has the power to mutate. So now we have to see how our community can respond to the measures. The first thing that we have to consider is the epidemic situation. For every member of the public, what is their immunity barrier like? And what is the global situation like? And if there are any new subvariant strains arriving in Hong Kong, we have to consider all these factors. We have to be very careful when we want to adjust our anti-epidemic measures. Just then, I said that we are taking baby steps. This is because we don't want to see a large fluctuation so that we can be on the road to resume to normalcy. Does Dr. Lau has anything to add? Yes, thank you. Actually, after all these fluctuations that we have experienced before in the number of cases, every time we have learned something new. We learn how we could provide the best possible services for our citizens. For now, we see an increasing number for cases from RCHE, but for the proportion of patients using ventilator or oxygen therapy, the proportion has remained unchanged. For oxygen therapy, perhaps 10%, ventilator less than 1%. For the adjustments, we have assigned more designated clinics and enhanced services on teleconsultations. Yesterday, we have issued a press release. We have increased the quota for teleconsultation so that for members of the public, if they are unfortunately infected, then they could seek medical attention as soon as possible. Most importantly, for appropriate patients to have the proper medication. As you all know, the epidemic has evolved over time. So from the earliest measures, just washing hands, wearing of masks, to vaccination, the whole situation has evolved, and we have become more adapted to tackling the epidemic. Of course, if you are sick, then you need to get rest. And if you're age 60 or above, you don't need to have any symptoms. You don't have to feel unwell. You can still seek medical attention at designated clinics or through teleconsultation and administer oral COVID medication. This can reduce the chance of serious cases or deaths and also decrease the stress on public hospitals. We increase the quota for teleconsultation so that members of the public can seek medical attention and medication as soon as possible. This is to strike a balance. Every time we cut back on our services, patients that are most affected are those with non-emergency services. They are patients as well. They need to receive medical attention or consultation. So we need to strike a balance. But of course, if the number of people hospitalized remains on the rise, adjustments will have to be made, and I'm sure that the public will understand. But for the time being, we need to adjust the measures. And we ask for your cooperation. Wash hands frequently, do tests regularly, and get vaccinated. If everybody does their part, then we will be able to resume to normal very quickly. Well, I have something to add too. Just then you asked whether the number will continue to go up from 9,000. Well, actually, other than the number of confirmed cases, one thing that we are concerned about is the seasonal influenza. If the weather turns cooler next week, well, people from the industry will know that when the weather turns cold, then the A&E department will be full of patients, especially elderly. So if the number of seasonal influenza cases is on the rise, then for the young and the old, the situation can get really serious, and we have to consider that as well. And
I'm from TVB. As we know that there is an increasing number of cases, it's now 9,000. It's very likely that it will go be above 10,000. Most people in Hong Kong have received 3 jabs. Would you make it mandatory to get the 4th jab, making it a requirement under the vaccine pass? Now you treat an infection as 1 jab. Would you make any adjustments? For people who have been infected, they still have to receive the next dose after a certain interval. Would you make any adjustments as to the period of time in between? There are different schools of thoughts. Well, if you have received, if you have been infected, there is a certain level of antibodies. The T cell has memories. If you are young, if you are in your prime, if you are aged between 18 and 49, then you are very well protected. You don't need the 4th jab unless it is specially required. But we believe that for elderly people, they still have T cell that will remember the antibody. What we are concerned about is not those who have received 3 jabs, but those who are unvaccinated. Above the age of 80, there are only 60% of people who have received 3 jabs. For between age of 3 and 11, only 30% of them have received 3 jabs. So our priority is to protect the old and the young. And as to whether second infection will be treated as another vaccination, I'll defer to Dr. Chung. Well, if you are infected, we will count that as one infection. So if you've been infected 3 times, we don't count it as having received 3 jabs. I'm from Hong Kong Economic Times. I'd like to ask about the hospital authority for non-essential, non-emergency services. What is the percentage of reduction? The teleconsultation service, what's the usage rate? Private hospitals, do they start admitting COVID patients or not? And in relation to the anti-epidemic measures, any chance of relaxation? And just now you said that you can't estimate the number of cases that will increase, but what's your assessment about how long the current anti-epidemic measures will stay? I will defer to Dr. Lau first. For non-urgent services, it's actually gone back to the pre-COVID situation. We have not made any adjustments for non-essential services. We're talking about outpatient service. Quotas has been shifted to designated clinics, but for non-emergency service, for treatment and operation, the level is the same as that before COVID. In relation to designated clinics currently, we have about 80 or 90% of utilization rate. We've been monitoring the situation. Yesterday, we have increased the quota. The reason for that is because we wanted to make it easier for people to make an appointment. Say, for example, well, if you can't get an appointment this evening, then you'll get one early in the morning tomorrow and you'll get your medication. We're still liaising with private hospitals. Currently, we're using about 200 of their beds. We're all aware that if the situation worsens, if we need more beds for COVID patients, then we will continue to talk to them about a possible increase or a higher turnover. So next Wednesday, just now you've heard from Dr. Chuang that at this moment of time it's very difficult to predict whether it's peaked or where the peak is. As you recall, when it comes to relaxation of social distancing measures and anti-epidemic measures, we have to first consider whether we have sufficient capacity in our healthcare system. If it gets very cold next week, from my experience, there is a very good chance that the number of admissions will shoot up. So it's very difficult for me to answer you. I'll have to wait to see. The gentleman at the back. I'm from Mingpao. A question for Dr. Lee. You said twice that you would want to wait and see, and at the same time you said that it may very well stay unchanged. So what is actually going to happen? Dr. Chuang said it's very difficult to list out the reason why. If that is the case, what factors will you take into consideration to decide whether there will be further relaxation? And you said that you will have to keep in view the epidemic situation. Does it mean that you don't rule the possibility of backtracking? Are there any indicators? And if these indicators appear, then you will have to change your measures back. Let me make it clear that at this moment of time, there won't be a new round of relaxation. All the measures stay the same. Regarding the reason why, we don't know yet. We guess that that is because of an increased number of activities, and there are people who are unvaccinated and they have been infected before and the level of antibody has dropped. Well, are there any ways that we can control the number of cases from rising? First, wearing of masks. Secondly, get vaccinated, especially the booster. We keep talking about the elderly and the old because the vaccination rate for these two groups are low. And if for most age groups, they have a good protection, then for these two groups, then it is very obvious that they don't have as good a level of protection. In relation to RAT, well, it is to make sure that you are not infected. And if you are, then you know to protect yourself and others. And as to whether we will backtrack, is the last thing we want to do. But if our healthcare system is under pressure and if it is on the brink of collapse, if COVID patients can't get proper treatment, then we have to tighten our measures. But it's a situation we do not want to see. The reporter on the left.
Okay, so about the bivalent booster. So you said they could only be used as a fourth jab. So why aren't they recommended for people who could be going for their third jab or even earlier jabs? And the second question, because cases have been increasing and with over 9,000 cases today, so how's the trend and are you expecting cases to increase continuously or even reaching the 10,000 mark or even higher? If the situation continues or even getting worse, will the authorities tighten the measures again? Thank you.
Okay, I first answer the booster dose, the bivalent vaccine, and then I leave the question about the trend or the prediction for the infection to Dr. Zhang. Dr. Zhang. For the booster dose, the bivalent vaccine, according to the experts that advise our government, the fourth vaccine is registered only for as a booster dose. It is not suitable as a primary dosage. In Hong Kong, the primary dosage is the first 3 doses. So that's why, for the bivalent, it will only be available for the booster dose, such as the 4th jab. So if you are having the first dose, you can't actually have the bivalent vaccine for your 2nd or 3rd dose. So for the vaccine protection?
So we have observed an increasing number of cases recently, both locally reported cases as well as imported cases. So this may be due to a number of factors, such as increasing in the local social activities, increasing in the number of imported travelers, resulting in increasing number of imported cases, and also there may be some waning immunity among the especially those residential care home elderlies who have been infected early in the February or March this year, and already more than 8 months have passed, and maybe some of them getting reinfection because of the waning immunity. So, and according to the real-time reproductive number as published by the Hong Kong University, the R0 at present is around 1.3. So we are expecting the number of cases are still increasing in the near future. But of course, we can't predict the exact number and the peak number.
Okay, so at the current, further, go back to tightening the social distancing measures. This is the last thing that we would like to do. So that's why in the very beginning, when we start to do the relaxation for the existing measures, we do it in a very slow, controlled pace so that the surge of the positive cases or the surge of the COVID will be actually in a more tolerable rate so that we will not causing our medical healthcare system to collapse. So if the situation turned very, very bad, like, the whole medical system is collapsed, patient with COVID or no COVID, they cannot access any medical services. At that juncture, of course, we need to tighten the social distancing measures. Yet, this is the last things we would like to do. So that's why we would like to withhold the relaxation at the current moment, status quo, and then we will observe the situation to see what the trend of the infection. Meanwhile, we would like to, actually advise the citizens in Hong Kong, basically wear your mask, do the vaccination as soon as possible, both COVID and also the flu vaccine, as well as testing. Just, whenever you feel a little bit of discomfort or actually you feel a bit sick, you can actually do the test to check whether you are infected or not earlier, and so that you can get the treatment earlier.
好，我哋問埋最後兩個提問。尾二嗰行嗰位。
Last 2 questions. The one in the penultimate row. I'm from Hong Kong 01. First of all, I'd like to ask, some experts think that the government should update on a daily basis the usage rate of COVID medication. Is there such a need? Dr. Lau said that there will be an increased supply of oral medication. What is the extent of the increase? Would it be put to use on a territory-wide basis? Are there any cases that remain serious after having taken the medication? Well, there are a lot of Hong Kong people who have immunity, but at which level do you think we will get herd immunity? I'll defer to Dr. Lau about the oral medication. As said yesterday, that is the 23rd of November, the HA has dispensed for over 150,000 2 types of oral medication, 51,000 molnupiravir and 100,000 people Paxlovid. We will first choose Paxlovid because the efficacy for reduction of serious cases and fatality is higher. But for patients who have contraindications, then we will prescribe them with molnupiravir. But it depends on the case. Well, patients may seek medical attention at a designated clinic or use a teleconsultation service. We will explain to them about the situation and the need to use oral medication. We have been increasing our service capacity because there are more and more confirmed cases. With an increasing number of cases, the demand for oral medication increases. If we increase our service capacity as soon as possible, then we will be able to dispense the oral medication to them as soon as possible, which is conducive to protecting our healthcare system. Apart from teleconsultation service, we also actively call high-risk groups, including elderly patients, children, and people who are immunocompromised. Every day we call. We made thousands of calls. Yesterday we have made 2,700 calls. We would like to remind patients that if they have contracted COVID, for some patients, they may not be aware that they are high risk. And we will remind them. If necessary, we will make an appointment for them at the designated clinic. We want to ensure that patients, if need be, will be dispensed with the medication. Regarding herd immunity, there are about 80% of the population that has received 3 doses. If we have to be more precise, you'll find that for some age groups, the protection barrier is quite weak. Say those above the age of 80, only about 60% have received 3 doses. And between 0 and 2, only 10% of them have received 3 doses. For these groups, if they get infected, then they must see a doctor. So apart from the level of protection they have, we also have to take into account the capacity of our public healthcare system. Because for elderly people, if they contract the illness, they may have to be admitted. So we have to take everything into account. I'm from Oriental Daily News. I'd like to ask, just now the Undersecretary talked about 200 people who have applied for the provisional vaccine pass. How many of these cases have been approved? And how many of them are involved in the cases of abuse of the exemption certificate? And I'd also like to ask Dr. Lau, the current usage rate of designated clinics, and what is the percentage of teleconsultation service used? Dr. Chuang talked about reinfection among elderly home rising to about 20 to 30%, and it's much lower in the community. But residents in care homes have been vaccinated. Are there any reasons resulting in the higher reinfection rate? I will take the first question. I will defer to Dr. Lau of the second question, and then Dr. Chuang. 214 transitional vaccine pass. Last time, as I said, that if they go to designated locations, then they will be given out. So these are valid ones. There are about 100 or so that have received 1 dose, and about 70 of them that have received 2 doses. Dr. Lau. About a month ago, that is end of October, those who physically visited designated clinics, there are about 500 to 600 people. And in the most recent week, it has risen to 800 to 900. Yesterday, it's 950 people who have visited the clinics. So it's about 90% of the quota. When it comes to teleconsultation service, about a month ago, is about 700 to 800 people who have used the service. Number of people who have used this service is higher than those for a clinic because it's easier to use. But last week is over 1,000. Yesterday, 1,200 to 1,300 patients who have used the teleconsultation service. We've been increasing the quota. About 90% of the quota has been used. We, of course, hope that the usage rate will drop when the epidemic eases. But if the epidemic situation gets worse, then we will make adjustments because it is a very effective way to treat patients and to prevent serious conditions. Regarding elderly home, in the past few weeks, the number of confirmed cases account for less than 10% of the overall number of cases. However, in the past few weeks, there is an increasing number of reinfection. We reckon that is because most residents have been infected back in February or March, quite some time ago. And the antibody level has dropped, so they have a lowered immunity. And if there are confirmed cases in the same home, then there will be transmission. For the community, overall speaking, is about 3%. But I don't have the time to look at the breakdown amongst elderly people. For people who have been infected a while back, if we look into it, we may see the percentage of reinfection rate being higher. Thank you very much for attending.